Good afternoon. I'm Angie Murad. I'm a patient educator with the Mayo Clinic Cancer Education Center. I'll be moderating this session, and we're so glad to have all of you with us today for this live webinar titled Enhance Resiliency and Manage Stress, presented by two wellness coaches from the Mayo Clinic Healthy Living Program. So first, I'd like to introduce Amy Charland. She's a national board certified health and wellness coach, like I mentioned, at the Mayo Clinic Healthy Living Program. She has worked as a wellness coach since 2005 in a variety of roles at Mayo Clinic. During her tenure, she has been involved in numerous lifestyle medicine initiatives, from disease management pilot programs to executive wellness. And then I also have Karin Pyan, is also a national board certified health and wellness coach. She is also with the Mayo Clinic Healthy Living Program. Since 1981, she has worked in a variety of roles, assisting individuals making positive behavior change and finding enhanced well-being at Mayo Clinic. Karin has been involved in numerous research studies, most recently working with cancer study, implementing coaching services to assist with symptom management, well-being, and quality of life. So we want people on this webinar to know that the session is being recorded so that individuals who are not able to join us for this live session, they can watch it later. For those who'd like to view the webinar again, the recording usually takes about 3 days to be edited and then put into our video library tab on our cancer education group on Mayo Clinic Connect. And just to let you know, Mayo Clinic Connect is a digital platform where patients, family members, and their caregivers can connect, get evidence-based information, and get access to information about classes that we offer, whether it's in our center or virtually. And we encourage you all to follow the cancer education blog on Mayo Clinic Connect so you can stay up to date on upcoming webinars and other educational offerings that we have. So I will be putting the link from the Mayo Clinic Cancer Education blog in the chat. And I'd also like to just take a quick moment to announce some upcoming webinars coming up in March and April. So March 29th, we have a webinar from 1 to 2 p.m. Central Standard Time on cancer-related fatigue. That will be with our patient educator, Janine Kokel. And then on Thursday, April 7th, 2:30 to 3:30 Central Standard Time, another patient educator, Tara Register, will be doing a webinar on radiation skin changes. And then the last one we have that's set up is on Wednesday, April 13th, 12:15 to 1 o'clock Central Standard Time on disease-fighting foods with a registered dietitian out of Mankato, Grace Fieldberg. So please remember to check these out when I put the link in the chat. And just to let you know too, we'll be taking questions at the end of this session. So if you have questions related to this webinar topic, please put them in the chat and we will get them answered. So I'm pleased now to turn this over to Amy and Karin for their presentation. Thank you.
Thank you, Angie. Appreciate that. And welcome, everyone. Amy and I are both, as Angie mentioned, wellness coaches, and happen to have the privilege of working both in the wellness area and feel very passionate about our work with patients in the clinical setting. So sometimes people are not aware or familiar with what a wellness coach is. So I just want to briefly talk about that. You know, what does Amy and I do? We work with patients. We help people achieve their goals, the goals that are very important to them in the wellness area. So basically, we offer guidance and support with patients that are addressing their well-being, and it may be while they're also in the midst of a very challenging diagnosis. So as Angie mentioned, today we're going to be talking about some resiliency practices that we hope you may find to be very helpful.
All right. Thank you so much, Karin, and welcome everyone. So wonderful to have you all here. So just a quick overview of what we're going to be covering. Today, we're going to take a look at the definition of resiliency, because whenever I share someone the idea of resiliency, I usually get a blank stare. So we wanted to just set the foundation of what is resiliency and what does that have to do with stress management. And then we want to help to create some awareness around the connection between resiliency and stress, and how building resiliency can really help us to manage those challenging times. And a big part of what we're going to be talking about today are those practices to help you to manage those stressors, especially because you are going through a very challenging time in your life. We want to be able to support you in finding ways to just go through this experience and not have the distress of that. We'll be talking a little bit more about how to shift away from distress to really a sense of eustress, which is good stress or calm. So I'm going to hand it over to Karin here. Karin, do you have that? Oh, no, this is my slide here. We're going to talk about that definition of resiliency. And I'd like to share this story. There were a whole group of physicians who got together in this room. This is how the story goes anyways, is how they got together in this room and decided, hey, how is Mayo Clinic going to define resiliency? And they decided the best way to describe it is about how we manage and grow from life challenges. Because often when I mention resiliency, folks will say, yeah, isn't that like maybe about bouncing back, or maybe it's about strength training? I'm not really sure. But we really like this definition of growing and learning from life's challenges, because when we approach life in that way, we become stronger, we become more resilient, we're able to take on those challenges that come our way throughout our lifetime. All right, now I think it's Karin. You're the next slide here.
So a cancer diagnosis is a very, very personal experience. And I know that because I've just had many, many conversations with patients that may have been in similar situations with a challenging diagnosis. And what I have found to be so amazing is that even though it's despite it being a difficult diagnosis, the experience has also allowed those patients to really discover some kind of incredible strengths that they weren't even aware that they had. And so this is truly where you all show your strength. There may be some things that Amy and I talk about today that you may already be practicing. And so I just encourage you to even take a pause and kind of acknowledge the strengths that you may already have. So as Amy described and defined, how we manage and grow from life's challenges is how we define resiliency. It's really something that we can learn and we can develop. It's not something that's just natural that you or I have, but it is truly something that that we can learn. So I want to throw out this question for you to be thinking about. How do I build my capacity? What can I do to promote my healing, my recovery, and my overall well-being? And so Amy and I are going to be sharing some strategies that hopefully will allow you to experiment with them to help you build your capacity.
I love that, Karin. And as I think about capacity, one way I think about this is like when it comes to resiliency is like a muscle. And we need to build and strengthen that muscle of resiliency, just like we would like going to the gym and lifting weights to build our physical muscles. And so thank you for sharing that building of capacity. And just to set the foundation here, I'd like to share with you the 4 types of resiliency. And yes, one of them is making your body stronger. And this is through healthy eating and exercise and sleep and getting enough water in. and just making us physically stronger and more resilient and have stamina when challenges occur. But then there's also this mental resiliency, making our brain stronger. So doing things that are cognitively challenging, like playing a game. Earlier today, I was just talking with someone who wanted to get back to doing puzzles, has wonderful memories of doing puzzles and wanted to get back to doing these puzzles. She just purchased one that she's super excited to get started on. So activities like that can make our brain stronger. But then there's also emotional resilience. And this is where we experience those positive emotions. And it's not to discount the negative. It's just looking at these positive emotions, because we know through the research that positive emotions help to build our capacity. And building our capacity can help with just dealing with lots of life's challenges. And we can do that through emotional awareness as well as emotional intelligence. And I think through the practices, you'll start to see how these start to play out, these 4 types of resilience. And finally, just connecting with others, that social resilience, making those connections and maintaining those connections, finding that meaning and purpose in our lives. And even if we feel like through the diagnosis and the challenges of what we're going through in our lives right now, that meaning and purpose is so incredibly important. And once again, we'll be talking a bit more about that.
Yeah. Amy, I have a really a story that I always love to tell that really is connected with that social area. And I have someone that every time I would be on a session with them, a video session, she would be smiling and just beaming, just happy, even though she was going through some really tough times and dealing with fatigue from her treatments and not able to work. And so I commented to her, as, just how amazing her resilience was, that she was smiling and just always seemed so happy when we would be on our sessions. And she recognized that. She was like, no, I have these times when I'm alone. That's kind of my low time. And really what came out of our conversation is that she recognized that when she was connected with others, that really made her feel happy. And so that social connection was really, really something that was important to her. And what came out of the whole interaction was that she set some goals to initiate making contact with either a friend or a family every single week. So she didn't sit back and wait for it to happen. She took that initiative because she knew that that was something that was so important to her. So it's just an example of how that social piece of resiliency can play a role for you. All right, Amy.
Okay, as I mentioned earlier, the idea of distress, which can happen whenever we are in a very challenging situation, whether it be work or a medical diagnosis or whatever that might be. And so we might find ourselves feeling exhausted and burnt out and fatigued. And that may be due to stress. It may be due to other things going on medically as well. But distress can definitely really lower our immune system. It can make us feel like we don't have much energy. And so what I talk a lot about with patients is this energy balance. And how we find that energy balance is we start to move back to, hey, how can we find some positive stress, or how can we make the stress a little bit more positive? How can we move towards relaxation and calm? And what's interesting is what we have found through the research is that those that have some stress actually perform better than those who have no stress. But yet, as you can see from this bell curve, when we have too much stress, especially negative stress, that can lower our performance as well. So what Karin and I are going to be really focusing on today is sharing practices with you to help you feel that you have the energy and the focus that you need to be at your best, even during this very difficult time in your life.
So in a sense, Amy, it kind of balances things out, doesn't it?
Yes,
You
yeah.
know, when we're
balance.
experiencing that distress, you know, with, you know, this challenging situation and challenging diagnosis. And if we can practice these resiliency strategies, that can help to kind of to balance that all out.
Mhm.
And I think it really signifies how important it is to be in tune to your stress. And so sometimes, because stress is so much a part of our life, sometimes we aren't aware that we are even feeling stressed. And awareness is really a key component of building your resiliency. It's like the foundation. It really is having the knowledge or the understanding that something is happening. And in a sense, it allows us to be able to know when we need to do something or make a change. And if we don't have that awareness, you know, that may leave us a little bit stuck and not really knowing, you know, what to do. So I would love for you to think about the last time that you felt stressed. And these may be some questions that you ask yourself. Where is my stress coming from? What's happening today? You know, have there been some messages or some things that I've been telling myself, and noticing whether there are some patterns? And what has been my response or my reaction? I know sometimes for myself, I grind my teeth. I've had other people talk about holding their stress in their neck and their shoulders, having backaches or feeling irritable. So just encourage you to think about what are the physical symptoms or thoughts or, you know, particular moods that occur when you may be feeling stressed. And when you notice these symptoms, that may be the time to take a step back, take a pause. You might notice, you know, what's going on with your day, what kinds of thoughts are going through your head, or what have other people said to you that may have an impact on you. So this awareness is really a skill. And it's, as I mentioned at the beginning, it's really the foundation of resiliency. So now we're moving, Amy and I are moving into these resiliency strategies. And self-care is often a theme. And I'll just share from my experience with working in that cancer area. And I want you to think about, what does self-care look like for you? So oftentimes, some of the comments that I've heard is, oh my gosh, I have no idea what self-care is. I have spent my life taking care of everybody else, or I've been devoted to my job, or just other tasks. And oftentimes my own priorities or needs ends up at the bottom of the barrel, or sometimes I say the bottom of the totem pole. And so these categories on this slide, as you can see, are just some things that have come up within self-care, within these conversations. For example, being kind to yourself, giving yourself grace. When things don't go right, how do we manage that? And it really means, yeah, showing yourself some kindness. We often are our own worst critics, and we can be very hard on ourselves. And oftentimes we think that that's going to motivate us, but actually it really doesn't. It generally pulls us down further. So showing kindness, and also when we think about the compassion, it really means to practice talking to yourself as if, you are a cherished loved one. I always love this strategy of when you hear negative messages in your mind, to recognize that, have that awareness, like we talked about the last slide, but also ask yourself, with those messages that I'm telling myself, would I say that same thing to my significant other or my kids? Sometimes we'll say, oh, I blew it. Oh, you know what? I'm no good at that, or I can't do it. And when we ask ourselves if we would say that to our children, absolutely not. And so it gives you a little bit of a different perspective to, number one, be aware and notice when you're telling yourself negative things, but also to recognize that it's important to treat yourself with compassion. So when we think about our needs, this also comes up within the conversations. Oftentimes, as I mentioned earlier, needs are somewhat at the bottom of the list, our own personal needs, when it's very difficult to prioritize them. And sometimes we have to give ourselves permission to do that, and to learn how to move ourselves a little bit higher on the list. I had one person that I was working with, and she was a perfectionist. She loved details. And prior to being sick, this all worked for her. But once she became sick, she realized that she was continuing to prioritize by keeping her house clean and doing all the other tasks she needed to do. But her own needs were still at the bottom of the barrel. And so our conversation was about, how do you bring yourself up? How do you take some small steps and begin to understand your needs, and then start to prioritize those? And the final thing is, offering yourself some nourishment. Like, what does that mean for you? It might be a cup of tea, sitting in a comfortable chair, in a special room at home for 15 minutes. It might be going out for a walk. Maybe not today because it's kind of dreary, but going for a walk and noticing, the birds and the trees. Or I have one patient that's what she's been spending her time doing, is noticing the daycare kids across the street and really trying to stay in the moment and give herself a gift of whatever that may be. So, Amy.
All right. So gratitude. It's fascinating. There's so much research behind gratitude, and there's actually a really close link with gratitude and joy. But what we're going to be talking about here today is this idea of really retraining our brain to focus on what's working, because our brain is just hardwired to focus on what isn't working. It's survival. And what we want to do through this practice of really focusing on what is working is to be able to train our brain to look at, hey, there's some things going right in my life, and be able to refocus on those things. So what I'd like you to do here for just a moment is just think about one thing that went well today so far. If you can think more, that's wonderful. But I'd like you just to take a moment to think about one thing that's gone well today. And once you have that one thing, think about why it went well and what your role was in that. And that's very important. What was your role in that one good thing? Perhaps it was the response you had to a situation. Perhaps you had done something to bring this good situation to fruition. So it's really important to see that we do have control over some of the situations. There's a lot we can't control, but there are some things that we can control, and there are some things that are still going well within lots of things that may feel like they're not going well. And so, yes, I really encourage you to think about that one good thing that's going well today. If you really want to be serious about this type of practice, the research shows that at the end of the day, if you write down 3 good things that went well each day, that can lead to greater happiness and health benefits as well, such as reduced stress, such as increased immune system. There's a whole host of benefits for doing this practice. And so I invite you just to consider doing this as a daily practice.
The thing I love about gratitude, Amy, is that it really brings you to the present moment. And it kind of takes you out of maybe a state of worrying and brings you, it really creates less space for worrying and more space for looking for the good. So such a great practice. Yeah. Amy.
All right. So engagement, and what we're talking about here is during really difficult and challenging times in our life, we sometimes start to disconnect because we don't feel well. And it's so important to still engage in life. And I think Karin had shared a little bit ago under self-care, this time in nature. There's so much research behind this concept of just spending time in nature and how that can be so good for our health. There's even this idea of forest bathing, which is just going into the forest and bathing in just that sense of nature. And so when you go outside, as Karin mentioned earlier, just be in that moment and aware of all the sights and smells and feeling the wind on your face, and just really using all 5 senses to be so fully in that present moment, that is all that is there, is just being in nature. It can be so fully immersive that we can forget about all our worries and fears for that moment. I think also it's very important to think about doing what we love still. I have worked with a wide range of folks. I have gone through a wide range of very challenging diagnoses, and they tend to back away from those things that they love, whether it be playing guitar, doodling, doing art, scrapbooking, whatever that might be, needlepoint. And some of the work that I do with them is, maybe we can't do what we used to do in those areas, but we can take maybe 5 minutes just to re-engage in those things that we really love to do. And it's also great to be able to tap into our strengths, because perhaps what you love to do is also tapping in a strength that you have. And when we tap into our strengths, that can make life feel easier. And what's wonderful about that is if we can tap into a strength, I'm trying to think of an example here of, I work with so many folks that are high achievers and are very committed to their own wellness. That's a strength. And that's a strength that they can use to support themselves in doing what it takes to feel well again. Perhaps it's following protocols or following a healthy diet or whatever that might be. Maybe their doctor's giving them certain recommendations. And so using that strength of just that commitment to wellness, that high achiever mode can really be a strength. And there's so many different types of strengths. Another one is a strength around beauty and just re-engaging with beauty around us, whether that be in nature or in our home environment. There's so many ways that we can use our strengths to support us through these challenging times.
Yeah, this reminds me, Amy, of I had someone that was a crafter and really considered herself an artist. And it was just a part of her life. It was part of her identity. And she had stopped working on projects. She called them her projects. She always had one going every day. And so she ended up getting this started again. She started working on her crafts, and really provided herself with time every single day to work on these projects. The results was that she felt like she was being creative. It energized her. She felt like she was more productive. I think it offered her some structure to her day, but the best part is that it was inspiring to her. So it kind of got her excited, about things. It gave her something to look forward to.
Mm-hmm.
Yeah.
Love that.
Yeah. So cancer affects all aspects of your life, including relationships. And as you think about social support, take time to reflect on what does that mean for you? And there's so many different types of support. And that question is, well, what do I need? And how do I start to express my needs in that support area? And possibly considering how do I establish maybe some other connections, like the Mayo Clinic Connect or a cancer support group, someplace that may offer a safe space for you to share some experiences or some of your challenges or some of those emotions. I always think about someone that I worked with, and she said, gosh, I didn't know that I could talk about my fatigue because her family wanted the best for her, and they just wanted her to get well. And so every time she would bring it up, I think they wanted to avoid it. And so I think for this particular person, it was really important for her to figure out who is that support for me and what do I need and how do I express it to them. And strengthening relationships, like how can you do that? What are some steps that you might do, to strengthen those relationships? Making a list of people to stay in contact with, and possibly doing what I talked about earlier with the person that I spoke of that took the initiative to reach out to a family or friend, even though that was really challenging for her. And she recognized that when she's alone, she worried. When she was with other people, she felt connected. And that was just so important for her. So oftentimes I have found that patients that are experiencing challenging, difficult diagnosis feel stuck at certain points. That's been a part of the conversation. Some of the things that I've heard, it's been, I just want to get out of my chair, or I want my body back, or will I ever be able to do the things that I have done in the past? And I have one, particular person in the past that I worked with that asked that question to herself. And she realized that it was leaving her stuck, kind of like spinning her wheels and not able or feeling like she was moving forward. And so we started to talk about what does living her best life look like despite what is going on? What might that look like for her? And what happened is it pulled her out of the past to the present moment and allowed her to kind of figure out, what do I want for myself? Despite the challenges that I'm dealing with, what does that look like? It led her to really feel like she was stronger because she's really kind of learning from her own experiences. And it also led her to be thinking about her own identity. oftentimes when we're sick, that takes over and we disconnect from the things that we love to do. I think Amy and I have been talking about that. And so the things that are important to us that provide some identity for us, we want to really reconnect with those. And all of those things may allow us to feel like we are moving forward versus feeling like we're stuck. So this, I love this statement, and it's really about focusing on what we have control over instead of putting our energy into the things that we don't have control over. So the person I just spoke of that was, kind of a go-getter and very active, and, she's worried about, will I ever get back to that? And she realized that it was really important for her to be in the present moment, practice patience with herself, and to really accept things in the sense that, okay, I'm going to put my energy into what I can change versus wasting all my energy on the things I can't control. And that was just an empowering moment for her.
All right. And I just want to reiterate just the powerful statement that Karin just made about acceptance. And acceptance isn't saying, okay, I just need to accept that everything is horrible. It's more about accepting just where you are at in this present moment and just going, okay, this is what's happening right now. And just that awareness that Karin spoke of earlier, but recognizing there's some things that we cannot control, and instead of putting our energy into that, like Karin was saying, is put our energy into what we can control. And what we can control are a lot of these practices that Karin and I have been sharing with you today. And I also wanted to share with you, and I think this is our final practice here regarding meaning and purpose. And as you may have noticed, a lot of these practices overlap. Meaning and purpose also connects back with self-care, and it connects back with building resiliency and engagement and those other pieces that we've been talking about. So meaning and purpose, one piece of this is just expressing your passion. And sometimes this shows up in giving back. And I have just a brief example here. I was working with a young woman who was diagnosed with breast cancer, and her experience just brought so much awareness for her of how she wanted to support other women. And so being a survivor of breast cancer, she decided to start a whole foundation for breast cancer. And she designed this annual gala to bring in money to support other women. And this doesn't mean that you need to do something to that extent. It could be something really just simple, like giving back to a neighbor or someone that's just in need, maybe someone who needs just a cooked meal or whatever that might be, or perhaps in your work area, there's something you love to do that you're passionate about, and perhaps doing some volunteer work. Whatever that might be for you, it doesn't have to be something massive like a whole gala, but it can be so incredibly powerful to give back, because what that does is it gets you out of your own head. And when we're giving back, there's health benefits when we give back to others. When we show kindness to others, there's so many health benefits for us in just being the provider of that. And another piece of meaning and purpose is explore that creativity. I think I mentioned earlier the idea of doing arts and crafts and playing music and dancing, performing, whatever that is for you, even if it's on a smaller scale than what you had done prior to the cancer diagnosis. Just do something because it will give you energy, light you up in just those little moments. And it's also important to have that spiritual practice. I have worked with so many people who their faith is just underlying their resilience. And it's just so supportive of them being able to move forward. As Karin was talking about, that forward thinking and the faith can be such a wonderful underlying piece of that. And I think, Karin, you had a story to share here.
Yeah. I have a patient that her faith is really at the top of the list for her. And she has decided to, one of her goals was to search for scripture that was connected to whatever was important to her. And for her, it was, it was acceptance, patience with herself, showing yourself some self-compassion, being okay with kind of slowing things down and having reasonable expectations for herself. And so what she did is she memorized the scripture so that it was always handy for her. So when she was in those moments when she might be kind of hard on herself or, impatient with herself, that she would be able to recite in her head this scripture, and it would bring her back to the moment and give her just a whole different perspective on things. So yeah.
Thank you for sharing that, Karin. And I think we have our one of the last slides here. So what do you do with all of this? This is a really important piece. Hopefully there has been something in this presentation that resonated with you, something that stood out. And so Karin and I would like to invite you to think about, what is one thing that you can take forward from this presentation? One thing that you can put into practice. And it doesn't have to be anything massive. It can be something, just a little step forward. Just taking that moment out in nature, maybe for just a couple of minutes, just going out on the porch and enjoying that. Or just going and finding maybe those art supplies you've tucked away and just bringing those out. It doesn't have to be something really massive. And we also like to invite you to think about what is going well. What is going well? Kind of going back to that idea of those 3 good things, that gratitude, just to make an assessment of, hey, here is what's going well. And then as you move forward and you're trying to implement some of these ideas, just take a moment to assess and reflect on how is it going. For instance, if you were to take out those art supplies, you might want to reflect on, what would it be like to maybe just do a 5-minute drawing or a 5-minute watercolor, whatever that might be, and give it a try and then assess, wow, how did that make me feel? What was that like? And then adjust the plan as you continue to move forward. And did you want to add anything here, Karin, for next steps?
Well, I think it's important to realize that not everything is going to be a good fit for all of us. So what might be appealing to Amy and she might feel benefit from, I might not. And so, the great thing is that we have so many options here that that whole concept that Amy has talked about with experimenting, that's the opportunity to figure out what works for you and what doesn't work. I love this statement here, and this is really our final slide, and that is, wherever you put your attention on will grow stronger in your life. And I think that just speaks to the power of applying intention and being very specific with it. And as Amy said, to do this in small steps, such an important piece, that we're very realistic and reasonable about it. Yeah. Any other thoughts, Amy?
Oh, no, thank you so much, Karin. And thank you for sharing all your stories. I just think those are just really make, I think, this content come to life.
Yeah, thank you. All
Great. Right. Yeah, thank you both so much, Amy, Karin. Really, really great information. And just as Amy said, a lot of great examples of stories really help it bring it to life too. So one question that we have in the chat is your thoughts, or a wellness coach thoughts, on dealing with feelings of guilt, feeling guilty for not being able to do all the things they used to be able to do, not pulling their weight at home or at work, guilty for my role in being ill, not being able to have energy to be with their friends.
Yes, and perhaps both of us can answer. We might have a little different
Go ahead, yeah.
perspective on that, but yes, I can. As this comes up quite a bit when I'm coaching folks, is that guilt, and what I typically share with folks is, let's take a look at that guilt, and let's see if we can find that acceptance around it, because guilt is usually tapped into our values. And so if we can uncover the value that is being expressed or is being I like to say rubbed against, it's kind of irritating that value a little bit, then we can recognize, oh, okay, yeah, this is really something I really find valuable, and I can't control this situation, but I can accept it and I can move forward. And also Karin had mentioned this idea of just the awareness of that. That's all we can do, is just be aware of how we are responding. And it's not that guilt is bad. It's just, it can become overpowering in our lives and take our energy. And so often I'll have conversations about, where do you want to put your energy? And usually folks don't want to put their energy in the guilt. They want to put their energy into what's really important to them, such as family, or giving back to their community, or whatever that might be. Yeah, so I'd love to hear your thoughts on this too, Karin.
Well, I'll just add to you to what you said, Amy. I totally agree with everything that you said. That acceptance piece is such an important piece. And meaning acceptance is, we can resist and kind of fight everything, or we can shift that mindset to thinking about, what can I do? And I guess the other thing that comes to mind for me is support. And sometimes it's finding that right kind of support. And it may be through Mayo Clinic Connect, it might be through, a cancer support group, others that may have an understanding of, what that's like to be sick, and at the same time kind of have all that guilt. And so I think that's such a key area, is just making sure that you express what you need, and that you do have good support. And I love how Amy said with the, really made me think about gratitude too. That if we spend our energy and time, it takes up space in our brain, and in a sense, it leaves less space to be worrying about, the things that are bothering us. So, those are the things that come to mind for me. Yeah, excellent question.
Oh, good. Yeah, no, I thank you for that. That's great. One question that I was thinking about was, often during treatment, people that I might see, are so busy with appointments and don't really have a whole lot of time to really be thinking of other things besides just going to appointments and what they need to be doing. But often as they move into that survivorship mode, finishing up treatment, I think I know how you'll answer this, but I was just curious, when you move into that survivorship mode, you tend to have a lot of thoughts around, what about recurrence? What are your thoughts about that, and how you can help people with those thoughts?
Yeah.
Do you have some thoughts right away, Karin? I'll let you go first this time.
I think what comes to mind for me, we're really speaking about, true feelings and emotions, and very, very realistic ones. So it's, not something to, put aside at all. And I keep going back to that level of support, to to feel that you have good support in place when you're dealing with those kinds of thoughts. I guess the other thought that comes to mind, Angie, is just, again, shifting that energy and that mindset to, things like forward thinking, so that it doesn't really allow, your mind to be, focused on that one area. It's really, again, looking at what's within your control and what isn't within your control. And if we put all our energy into the things that aren't within our control, we can feel stuck. And this may be a really good example of trying to shift that to putting that energy into the things that will help you feel better and help you feel like you are in better control. I have patients say that all the time after they've kind of experimented and tested out some of these resiliency strategies, that a lot of times the response is, I have a more positive mindset and I feel in better control. So, I think it speaks to kind of the benefits of practicing these strategies.
Mm-hmm. Yes,
What are your thoughts, Amy?
I second everything you said, Karin, absolutely. And I was also thinking something important to remember here too. I'm just thinking of some other trainings that I've done. And it's so important to live for today and be able to see the joy in each moment. And if we can start to see the little bits of joy in today, that can broaden our mindset to see the possibilities and move out of fear and worry. And I think it comes back to this idea of kind of building that emotional resiliency, where we're really trying to reframe and look at things from a little different perspective. And like Karin had said, yes, what can we control? We can control following our doctor's recommendations. We can eat healthy, reduce sugar, exercise. Those are things we can control. And here again, like Karin had said, where do we want to put our energy? Do we want to put our energy into our fears and worries, or do we want to put our energy into doing what's important and living life today?
Thank you both. That's good. I hope that another one of our viewers had just said that she has someone who she's in her family and just really focused on recurrence. So hopefully that those responses help you with that as well. I guess I love how your message talks about small steps, small changes, giving yourself grace. I guess a question that others have asked is just, how do you know that this is all working? How do you feel like you're moving forward, or as Karin said, that you're not stuck?
Yeah, that's a great question. And there's different ways. As a coach, I often will invite people to track just perhaps where they are in that day. What is their energy level that day? Or what is their level of joy? Like on a scale from 1 to 10, what is your joy factor today? And so we can, if we track, there's tangible evidence that progress is being made, but that's not right for everyone. I certainly have worked with patients who just have this sense, and they have, though in their minds, some certain tangible things that they're looking for improvement around. And once they have evidence that those things have changed, for instance, if they find it easier not to respond in anger to something, that's a good indication that they're making some progress. Or if they're having just a better response to perhaps an individual in their family, or someone challenging their family, or they're noticing, oh, wow, I'm not being triggered by that really as much anymore. So there's two ways, but there's always something tangible to look forward to of, hey, I've made it. And so, and maybe Karin, you can speak a little bit more towards this, because we talk a lot about wellness vision, which is essentially, I think, what I'm talking about here.
Yeah. Well, and I'm not sure if I'm going down the same path that you were, but it also makes me, as you mentioned, tangible. I think the more tangible we make these strategies, the more that you're able to, put them into practice. So, we can think, oh, I'm going to practice gratitude. I'm just going to think about it, but our mind might be so consumed with worries that we don't ever get to there. So that's the benefit of actually, writing things down, is by making it more tangible. And I guess I would say, doing something once, you might not, feel those results. I think it's something that occurs over time, and that's what makes the resiliency strategies a little more challenging. It's not like eating 3 fruits and 3 vegetables, and we know that we did that. So Amy's, comment about tracking, but to add to that, I would, encourage just reflection time. So if you're not a tracker, it might be, I don't think that we reflect enough in our life. We don't take a pause long enough to say, gosh, how am I doing? Where am I at today? What's different, about today? Or even as you're practicing these strategies, how is it helping? And it might be through journaling. It might be having the cup of tea in the comfortable chair in the corner. I had one woman that did that every Sunday morning. And that was how she recognized, okay, how did my last week go? What happened with that? And it allowed her to almost plan out, okay, what am I going to experiment with this next week? What am I going to try that's a little bit different? So
I had a question that just popped up too. Like, how many times, and I know it's probably different for different people, but I mean, like you said, people often think, oh, that didn't work. They try it one time. Okay. How many times do people need to kind of try things to really see maybe results, or realize too that, and this is valuable information too, that doesn't work for me?
Yeah. Amy, what are your thoughts on that?
That's an excellent question. And I think that's the value of working with a coach, is so you have someone to talk it through with. Now that you have to work with a coach, it could be a friend, it could be a spouse, just to have someone to talk through that. It's like, I tried, let's just say, for example, taking a nature walk. I really didn't notice any benefit. And that's okay. And it's like, you know what? Maybe I'll try something else. And it's just a matter of just experimenting. But I also think there's the concept of not giving up too soon either, because these strategies take some time to take hold. And giving up too soon, you may not be able to see the benefit. And that's why I think just having that conversation with someone else can be very valuable, to talk it through and go, oh yeah, I guess I did feel a little bit better after that walk in nature, because we tend to just be an autopilot so often. It's hard to take that time to reflect, as Karin was saying, and really notice those nuances of progress. And that's where a coach can come in and go, oh, yes, well, here's what I'm seeing. And I remember one conversation, someone came to me and said, oh, everything just is horrible. Nothing went right. And by the end of that conversation, we had a list of 10 things that went well. And from what she experienced, and that had been because she had done the work to try something new. And we were able to unpack that a little bit. So Karin, I'd love to hear your thoughts.
Yeah. I think it's a trial and error. I think it's like, we like to use the terminology experimenting. And it means, part of the process of making change just overall is experimenting and trying something out and using, in a sense, your strength of curiosity as you approach it versus judgment. And then reflecting and saying, gosh, how did that feel? Is it worth it? I'll use Amy's example of the nature walk. One person may say, absolutely not, it would do nothing for me. The next person might go, and that's maybe a part of their identity and their interests. And so it really, connects with them. So I do believe it's just a trial and error of trying out these resiliency strategies and finding, really what works for you and what doesn't.
No, I like that. And I think even too, to that point is it may work one time, or in a certain situation, one of those tools, and another it works at another time. Like maybe nature didn't work one time, but you try it again another time. It's just not forgetting all the tools, I guess.
Yeah.
So yeah, no, I love that. I love strength of curiosity. That's awesome. So that's great. Well, good. Well, thank you again, Amy and Karin, so much for all of your wonderful information that you've shared. Just to let viewers know too, if you want to watch the session again, we will put the recording on our video library tab on Mayo Clinic Connect. And also I did want to mention that I put in the chat the link if you want to find a national board certified wellness coach too. So I think one of our participants saw that. So just wanted to let you know. And I'll put all those resources too that Karin and Amy had shared with me on Mayo Clinic Connect with the video too. So, okay. Thank you so much. Have a great day, everyone. Bye-bye.